am Dawn. This is Seb.
Hey.
And we are the locally world famous chiropractors in Orange County, California. Today's video we are going over the best glute medius exercise that we use here for knee pain. And we're going to do a little bit of explanation of why this works, why it would help with your knee pain. So the first part of this video is going to be a little more educational, but we are going to end with that exercise that you guys can incorporate at home and see what happens with your knee pain. Anything before we get started?
No, I think, why don't you explain the case study that we were kind of discussing?
Sure, yeah.
Because you've seen a lot of people like this, right?
Yeah, absolutely. So I've had a couple of case studies, or cases of people coming in lately who, when we do a knee examination on them, there's different presentations of the knee and where it hurts, but we do a knee exam on them and we see that they're rotationally intolerant, meaning things like standing up like this and rotating through the knee joint.
The hokey pokey?
Like so. Yeah, like this kind of hurts. Or any sort of knee testing where we're doing any sort of rotation through that joint causes their pain. Then we notice on that same side we do an examination of the hip, because you don't want to just look at the point of pain. You got to go up the chain and down below to see what could be causing this. We go into the hip and we find that the hip itself is actually limited on this side compared to the other side. So when you're lacking the rotation and the movement through the hip joint here, you try to find that movement elsewhere, and sometimes the knee just ends up being that dummy joint. So we're going to get into that, or Seb's going to explain a little bit more about it with Bob Norman here.
Yeah, this is Bob Norman. Why don't you grab the camera real quick just to make sure to zoom in on this joint. Okay, sorry guys, we don't hire a professional videography team. We just do the good videos, okay? And so this is the knee joint. It's important to realize that the knee joint is a hinge joint, meaning it likes forward and backwards a lot. It doesn't really love this, and it doesn't like this. And so it can tolerate a little bit of it, but if you subject it too much to that, as Don was mentioning, it starts to speak up. And so one easy way we can decrease pain is to shift the rotational load into a different joint. Okay, as you can see, as this femur rotates, if we look above and we look at the hip is a ball and socket. It can move a lot, okay? Since it can move a lot, we need to be able to get internal rotation and external rotation of this ball socket joint to deload the knee, okay? Because the knee, the foot is fixed on the ground and this femur is just rotating, okay? And so the exercise Don's going to show is going to help out with this. Oh, you want him to, we'll do this with him right there. So we're going to help out with getting this area, and it all starts with the glute medius and the glute max. Okay?
That's great.
All right, so do you want me to be on the table for this one, or are you going to?
Sure, you want me to take you through the exercise?
Yeah, take me through the exercise.
All right. Actually, let's put you, well, I guess the table should be right, yeah. Let's keep you there.
Okay, cool. All right, everybody. Thanks for being okay with that. Some people can pay for large production teams. Yeah, we can't.
All right, so better to do this on the floor for purposes of the camera and the angle. We're going to have Seb on the table here. You're going to have bad knee side down, okay? So the first thing I want you to do is, obviously he's propped up onto his elbow here, okay? This is going to be a really important part. This knee that's in the front, I want your foot to come out for me. Not this one, bottom one. Yep, just right there. So this back knee is going to be dead. It's not doing anything. It's just hanging out, okay? First part is I want you to pretend there's a cactus underneath your side here and get away from it. He props up a little bit. He's nice and straight through the spine here. Second part of this is I'm going to have you reach towards the camera, Seb. Reach, 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 reach. You're going to reach a little sticky point here, but you're going to start to feel pressure come through the bottom part of this knee here.
Yep.
I want you to pause in that position, and I want you to break through the ground with that knee there. The more you push in that position, your foot might even start to pop up on this backside here. That's how you know you're doing it correctly. So in that position, I want you to just try to break the floor. Don't go anywhere. Just press, 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 and breathe. Hold, 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 and then come out of it. Okay? If you guys are noticing, what we want you to feel through this is your glute. So right on the outside here, you're going to really start to feel this hip turn on.
Which glute?
The one that's down.
The down glute.
The one that the knee that you're pushing with is. I don't know why I'm so out of breath right now.
Don't rush. Don't rush. So now, because I know what comes up sometimes, I have my groin is pinching when I'm doing this. How do I stop that? Is that okay?
No. So you shouldn't have any groin pain. So we can play with positioning of the knee. You can go down or up and see if that helps. take a big breath into your belly and see if that helps as well. Those are some of the cues that I would give if people are having groin pain.
Okay.
Do you have any that you would add for that?
Sometimes sometimes they're focused on getting up versus actually just reaching and rolling. And so if you think about sometimes from the bottom half, if we're going to try to get this belt line to be like the focal point, imagine there's like a key ring right here. Try to bring the key ring to your knee. And so that rolling is what we're looking for. And what you'll probably experience at some point, when you get through enough of them, it'll feel like it's stretchy back there first before you actually create the tension against the floor. And so sometimes exploring the rolling enough, it kind of stretches the back of the hip out enough to where this stops. But you shouldn't be blowing through it. It shouldn't be like getting progressively worse.
I like that. So start with the stretchy feeling first, then progress to pause, drive the knee down, feel that glute really, really, really turn on. Do we want to keep them there or do we want to come up a little bit?
We can go up. Let's
go up a little bit. Okay, so progression of this, as long as you're only feeling glute really working on this one in that reaching position, reach, press with the knee. He's going to press so hard through the ground with his knee that he's going to come up a little bit through here. You're going to see he has some space he's going to let me through here. Yep, my hand is right here in between his hip, and he's reaching and pressing hard with that knee. I'm even going to try to push him down on the next one. He's not going to let me. Reach, come up slightly, hold, press with the knee hard. I'm going to challenge him here.
You're the devil.
And then he's going to slowly come down.
You're the devil.
You should only feel glute with this, you guys, okay?
So what should they experience after that then? If once we did that, okay, so that's a cool exercise. How does that help me?
It helps find the rotation through the hip joint, seeing if it helps with less pain in the knee afterwards. So you need an outcome measure.
So would that decrease that test maybe?
Yeah, possibly. So you can always get up and I chose this one because this is something that's a rotational challenge for the knee itself. But if you guys have any other movement itself that you have knee pain with, whether it's, I don't know, go for a quick jog, walk up some stairs, do a squat, get the glute loaded on that side and go back to those movements and see what it does for your pain.
Yeah. The misconception a lot of people have is that the knee hurts, let's treat the knee. Rarely ever is the knee really actually the major problem that's driving the problem. Obviously, yes, you can have swelling in there and the ACL could be kind of screwed up and blah, blah, blah. Yeah, that's all merited. And sometimes it happens after trauma, but it's like, oh, I woke up with this, or oh, I was kind of doing like mundane exercise and all of a sudden my knee started hurting. I wonder if it's damaged. No, it's not damaged. It's probably just that you're asking too much of it. So let's shift that load into another area. And the most common area where you can shift it into that has the best results is the hip and glute region. Obviously, we can argue and say the foot and ankle has a part in it. Yes, it does. But at least in my experience, if you shift it upwards versus downwards, the rotational the rotational tolerance, it actually gets better with the knee. So, yeah. But that's my experience.
Absolutely. Sometimes knee pain, it takes a little bit of time too. So don't expect to get up and you find 100% improvement. Just see if there's any improvement at all and just use it more. If you have trouble with this exercise, always reach out to us. There's other ways that we can get your glutes activated. Find that movement through your hips that you need to. You just got to reach out and let us know that's what you need.
Yep. And if you're wondering what step to take next, we do have a free gift for you. And as a lot of the videos on YouTube, we try to put a free gift in there so you guys have a good place to go after this. If you're like, wow, that worked, or wow, that didn't work, now what do I do? And so these are just general conversation points that people don't have roadmaps, okay? And so they make big mistakes in their care. They tend to treat the knee specifically when there's no reason to treat the knee. There's a reason to treat above. And so there's big aha moments that we want to share with you. And so if you click on the link below, or there's a link that's probably going to pop up in the corner, it'll take you to something that is completely free. And get it, okay? You got nothing to lose with that. If you want help virtually, as you can see through some of these exercises, we can coach you. And if you had success in this, you're like, wow, that works. We can help you virtually. Although you can see us in person, we're in Costa Mesa, California, we can help you virtually, and we're very good at doing so.
Say it again.
We can help you virtually?
We're really good at doing so.
Oh, we're really good. We are open at this time. That's what she likes to say.
Awesome.
Oh, cool. See you guys next time.
Yeah.